Hey, good evening, ladies and gentlemen, and thank you once again for joining us for this week's webinar on harnessing the power of local movements in advancing gender equality and SRHR rights amidst COVID-19. My name is Apio Winnie, and I am the program manager with Uganda Youth and Adolescents Health Forum, which has put together this webinar in partnership with the SheDecides Uganda movement. And its overall goal is to spark discussion around the power of local movements in improving women's rights and how we can collaboratively harness this effort to advance gender equality, promote women's rights, and challenge all forms of violence against women as governments address COVID-19. Now, the major objectives of this webinar are: one, to reflect, assess, and evaluate the local movements that are working to promote gender equality and women's rights, focusing on the journey so far, what has worked well, what has not worked, opportunities, challenges, and achievements that can be utilized in advancing women's rights amidst COVID-19. We will also have an opportunity to discuss opportunities for leveraging, linking, and learning from other similar movements, networks, coalitions, and alliances. As we might all know, the COVID-19 pandemic constitutes the largest global public health crisis in a century, with daunting health and socio-economic challenges. Governments are taking unprecedented measures to limit the spread of the virus, including ramping up health system and restricting the movement of millions. While COVID-19 has been declared as a public health crisis, its response has also brought an equally imminent crisis to human rights, especially in regard to women's rights and sexual reproductive health and rights, and the intersection between these two. Previous epidemics like the Ebola virus in West Africa resulted in long-lasting effects on gender equality, and yet still our governments have not learned from history. Stuck outcomes from crises like the Ebola virus included high school dropouts due to teenage pregnancies, increased rates of violence against women, and increase in maternal mortality. In fact, in Sierra Leone, more women died from maternal health complications than they did from the Ebola virus. So we are currently seeing similar instances, especially in regard to women's rights and sexual reproductive health rights. There's high numbers going up, but we clearly see that our governments are overlooking this and taking it for granted. We cannot allow history to repeat itself with yet another pandemic that is clearly magnifying and exacerbating existing gender inequalities. On that note, today's discussion is going to be an opportunity for us to discuss how we can be able to compel our governments to take action to women's rights. We will also have a list of great panelists who I will introduce briefly, but then they will also have an opportunity to introduce themselves right before we get into the discussions. We have Mrs. Tikala Itaye, who is the chairperson, SheDecides Global Movement. We also have Professor Grace Chomohendo from Makari University School of Women and Gender. We also have Anne Lumbasi from Center for Health, Human Rights and Development, which is CEHAD. We have Hajara Bate from Lady Mermaids Bureau. And then we have Eunice Musime from Akina Mama wa Africa, Alice Nayebare from UNFPA, and then lastly we have Kutsanai Motombo, who is a Women Deliver Young Leader based in Zimbabwe. So before we get a chance to hear from the panelists, I would just like to give the opportunity to Patrick Mwesije, who is the team leader for Uganda Youth and Adolescents Health Forum, but also a global champion for SheDecides, to give a quick welcome to the audience. Patrick?
Yes, thank Adi, I really hope you can hear me because I don't trust my connection. It's a pleasure to be on the call. Thanks to all panelists that have agreed to join in and share their perspective, and to all the participants who are already joining in. I think Winnie has gave a very good introduction to the call. But at Uganda Youth and Adolescent Health Forum, we are glad to be working with the SheDecides Uganda local movement to try to bring some of these conversations into perspective. We know that the COVID-19 pandemic and the lockdowns everywhere have resulted into, we've seen reports in gender-based violence and sexual exploitation and abuse, even when related services and prevention and response to this violence is not largely available. We see services are also under pressure. So we want to see really how, as partners, as experts who are working at the grassroots, in advocacy, in the academia, in different fields, can harness the already existing power, that alliances, harness that power to build stronger movements that could bring into perspective issues in line with gender equality, with sexual reproductive health and rights, particularly COVID-19. So we are surely looking forward for quite interesting conversations to try to analyze the problem, what some of the challenges that have, sprung up in regard to sexual and gender-based violence, but also SRHR, and key experiences that we could share, but then also importantly, how we can build a stronger movement and address some of these issues, and also influence the conversations at country level, rather at national, but also district level, as far as addressing COVID-19 is concerned. So thank you very much. Excited to hear from the panelists and also to read through some of the questions. And I think that's it from me. Thank you very much. And I wish us a very good meeting. Thank you.
Thank you so much, Patrick, for that. And once again, thank you for the great work that you are doing in this field. Before we start, I would like to perhaps just call in our panelists to just say a few words. If you could just tell us who you are, your name, organization, perhaps even country, just so people have a name to the face when we start. Could I start with Tikala?
Sure. Hi, everyone. It's great to be part of the webinar. My name is Tikala Itai Lachlan, recently married. It's exciting. But yeah, a little bit about myself. I've got my own youth-led organization in Malawi called Her Liberty, where we equip young people to be agents of change within their respective communities. We also do a lot of work around women and girls' rights as well. I am also the global chairperson for the SheDecides guiding group. So doing a lot of work in coordinating and supporting local movements globally with SheDecides, but working closely with the Secretariat for the Global SheDecides movement. And yeah, I don't know what else to share. I think that is a bit of me in detail, in brief. Yeah.
Yes. Thank you, Tikala. That's good enough. I should have said 30 seconds. Yes, thanks, Tikala, and it's an honor to have you. Could I reel in Professor Grace?
Yes, good evening. I'm Grace Bandiwa Jomhenda from the School of Women and Gender Studies. I think I come in this meeting as an academician, but also an activist who has been working with a number of NGOs and also working with government. I'm glad to be here, especially talk about the subject. Thank you.
Thank you so much, Professor, and it's an honor to have you too. So sorry about that. Lumbasi? Sorry about that. Just a minute.
Sorry.
Please mute your mic. Sorry about that. I'm going to have to keep muting, but it becomes a bit hard for me to mute everyone if someone is in the middle of speaking. Yes, Anne Lumbasi?
Yeah, so hello everyone. My name is Anne Lumbasi and I work with the Center for Health, Human Rights and Development, otherwise called SRHR. I'm a senior programs officer and I coordinate one of the coalitions that SRHR hosts.
Okay, great. Thank you so much, Anne, and we look forward to hearing from you later on. Hajara? Sorry, Hajara?
Hello,
Okay.
can you hear me now?
Yes, we can hear you now.
Okay, my name is Sanya Hajra Batse. I'm the Executive Director for Lady Mames Bureau. Lady Mames Bureau is a sex work-led organization. I'm also the chairperson for African Sex Workers Alliance, which is a regional network for all sex workers living and working in Africa. I also sit on the steering committee of Uganda Network of Sex Work Organizations. A board member. And yeah, I represent key populations on the Global Fund, Uganda Country Coordinating Mechanism. I'm happy to be here to discuss about issues affecting women. I thank you for the opportunity and platform to see that we can also raise and amplify voices of sex workers on this webinar. Thank you.
Thank you, Sanyu, and thank you for honoring our invite. And we also look forward to hearing you later on during our discussions. Eunice?
Good evening. My name is Eunice Musime. I'm the Executive Director of Akina Mama wa Africa. Akina Mama wa Africa is a Pan-African feminist organization. A key role is feminist leadership development and movement building. And I'm excited to be part of this conversation. As you all know, that sexual and reproductive health and rights is key, front and center to women's rights. So happy to be here.
Thank you for joining us, Eunice. And just like every other panelist, we do look forward to the strong voice that you have, especially on this topic. So, Kudzanai? Okay, Alice Nayabare from UNFPA.
Good afternoon, members. My name is Alice Nayabare and I'm a program specialist, gender and human rights from United Nations Population Fund. We do a lot of work around sexual and reproductive health rights, as well as prevention and response to GBV. And I'll be sharing what interventions we are currently pushing forward, especially in this season of COVID. And I thank you very much for inviting us.
Okay, thank you so much for that, Alice. As the other panelist that we will have once again is Kutsanai Motombo, who is he's a Women Deliver Young leader, and he's based in Zimbabwe and will hopefully be joining us later on in the call. So I think having Alice as the last person to introduce herself is a perfect segue into the beginning of this discussion, where we are interested in finding out what UNFPA is doing in country taking key consideration of the fact that globally we have seen UNFPA taking headstrong action towards ensuring that sexual reproductive health information and services are being accessed by young people and by women in spite of COVID-19. Yes, so I would just like to invite Alice to take us through some of the work that's being done by UNFPA, both globally and locally, and how is it that local NGOs can be able to piggyback on this great work in order to advance the rights of women and marginalized groups. Yes, Alice.
Thank you, Wynne. Are you planning to project my presentation, or I just speak through it from this side?
I'm just sharing it right now.
Okay, right. Thank you, members. Like Wynne has indicated, this has COVID-19 has brought both opportunities and challenges, and I believe that this is good for all of us in that we need to tap into the existing opportunities to enhance whatever work we are doing at different platforms, but also build our efforts to address the challenges, especially around access to sexual and reproductive health rights and information and services, as well as prevention and response to gender-based violence. We can go to the next slide. That's what I'll be talking about, a little bit of the background, the situation analysis. I'll give you a little bit of the numbers that we have faced here at Uganda level, the UNFPA response, and how the local CSOs can be part of the entire push factor that will see a better result for the women and girls in Uganda. Next, please. Just a little bit of the background. It is important for us to remember that Uganda received her first COVID case on the 20th. 6 others followed on 22nd. And the weeks that followed after that saw a rise in number. But we thank God that nothing has happened since in terms of fatalities. And the government seems to be really holding it under control. And we thank God that we are still safe. In response to the influx, the president, the government of Uganda, the Ministry of Health came up with quite a number of measures, including quarantine, lockdown measures, and prioritization of critical services that you have been able to follow through the media and different forms of communication that you have been receiving. And now, presidential directives prioritize the essential medical services and security, especially in this season of lockdown, leaving out the critical bits and parts, to me, which are at the center of the entire rights of women and girls and children in this country. And so I believe that in these lockdown measures, there was no attention on GBV, there was no attention on prevention of VAW, there was no attention on provision of sexual and reproductive health services and rights, and that left most of the women and girls exposed. And this has not only happened in Uganda, but it has happened all over the place in other countries. And you will agree with me that in times of emergencies, like Wynne rightly observed at the opening, when there are emergencies, women and girls tend to suffer in two ways, both as critical actors in the response, as well as victims that need care and protection. And we have been seeing this. If I'm to give you the statistics in Uganda, women are the majority health workers in our health sector. And that means that they interface with this pandemic in a greater way as compared to their counterpart, male health workers. We can go to the next slide, please. The next slide. Yeah, a little bit of the statistics. We have evidence that has been pointing to the increasing numbers.
Sorry, the next?
No, that one. Yeah, evidence that has come up shows that women and girls have been, women, girls, children, older persons, persons living with disabilities, those living with HIV and AIDS have been particularly affected in this season of COVID, and more especially women and children. Many of them are subjected to intimate partner violence. We have seen many cases of murder coming up against women, domestic violence cases, rapes, including gang rapes, physical assaults, defilement, and child neglect. And some of the cases that have been reported in the last 1 month, as I have tried to enumerate them below, are really worrying. Just in 2 weeks alone, we received 1,211 cases from GBV shelters, 13 of them across the country. Saudi Helpline was able to, in just a space of like 6 days, was able to receive 256 cases. Catholic Relief Services registered about 200 cases from 20 districts, and Uganda Police alone has received over 3,000 cases of GBV nature. And to me, that is something that is really worrying. And then we see adolescents and young boys being subjected to defilement, rapes, and victimization of all kinds. We go to the next one. When it comes to, then we see that many women and girls who head households have been subjected to sexual exploitation and abuse in order to access food. Most of Ugandans have really limited access to services. GBV survivors themselves are not able to access health facilities and other service points due to restricted movements, lack of public transport, and fear of COVID transmission. Now, when it comes to maternal health, we have seen a surge, which is also worrying, in that we are seeing maternal death increasing up to about 76 deaths per week here in Uganda. And then mortality and morbidity has increased as a result of malaria and maternal mortality. And this is basically explained by the fact that the entire nation is focusing on preventing and responding to COVID, and they have sort of forgotten these other important, equally important services that they are supposed to be attending to. We go to the next one, please. When it comes to UNFPA responses, we pursue 3 goals, and one is to ensure that we end unmet need for family planning. We end GBV, including harmful practices such as FGM and child marriage, and ending preventable maternal death. In terms of our specific responses, in the last 1 month, I can take you through it in the slide. Next slide, please. Yes. In terms of our role and what we have been doing in the last 1.5 months, one, we have put a lot of emphasis on continuity of sexual and reproductive health rights and services and other related interventions. And how have we done this? We are supporting government institutions and partners with provision of of PPEs for health workforce. We are supporting pregnant mothers and women with transport to access health facilities. We are working to ensure that there is continuous accessibility of life-saving sexual reproductive health and rights services. And we are supporting mobile clinics, especially with the help and partnership of AIDS Information Center to ensure that people living with HIV/AIDS continuously get their medicine, continuously access their ARVs so that they do not deteriorate. But you must agree with me that this is an enormous challenge. We cannot reach everywhere. We are only able to reach a few areas and not all. And our focus is on hard to reach districts, places with humanitarian concerns, and disaster-prone areas. That's where a lot of our focus has been. And we are also ensuring supply of modern contraceptives to ensure that men and women who want to make use of this do not actually fail to access them. And then we have also supported Ministry of Health and to come up with quite a number of guidelines on ensuring the continuity of critical services, especially for family planning, HIV, nutrition, and GBV, as I'll be enumerating about them later on. You can go to the next slide, please. Yes, the second issue that we are working on is to address GBV. And here we have worked with Ministry of Gender and Ministry of Health to develop GBV guidelines and ensure that GBV related services, SRHR related services are made part of the critical services continuity by the government. We have lobbied for space on the National Task Force, on the District Task Force to ensure that GBV and SRHRH are included on the package of services that are being delivered in this context of COVID. We have supported the training of trainers on those same topics. We have supported messaging and effective communication. I'm sure you have been seeing religious leaders, including the Archbishop, coming forward to talk about the need for peaceful homes, the need for use of family planning and avoiding unwanted pregnancies, especially around Easter period. That was all our work and our involvement. And then we have been advocating for integration, of course, of GBV and SRHR at national and district task force levels and activities. Of course, we have also worked on continuous engagement and guidance of policymakers to make sure that they come up with right interventions. We are heading different reference group meetings around SRHR GBV to ensure that the right interventions are garnered and put in place. And then we have come up with different, developed and disseminated communication materials and supported the continuous functioning of different referral pathways to support GBV survivors and those that are most at risk. We go to the next slide. And now, on the role of CSOs in advancing gender equality and sexual and reproductive health rights amidst COVID-19, I would want to say that there is no hard and fast rule of how to do this, but this is our take. We believe that local movements play a very key role in providing highly sensitive, neglected services by government and other organizations. So to us, this presents a center stage for CSOs, for local movements to come in and occupy the vacuum and ensure that these services are held, are provided. And secondly, we are believing that we should be into building, that the CSOs should build a critical mass whereby they are able to build networks and engage for better services. We believe that you can come at the center stage and hold the government and duty bearers accountable through advocacy, through lobbying, through, pushing for your rights. And then you can also play a very critical role in terms of referral pathways and the linkage to services, especially when it comes to helping victims of GBV, helping SRHR, people in need of services around SRHR and other related issues. And we also believe that you can engage in communication. Don't keep quiet, you're the voice of the voiceless. And so if you do not come through as CSOs to push their agenda, then it may become hard for those most left behind to gain their platform and speak for themselves. You can go to the next.
Seems like that's for the last.
Thank you very much.
Thank you so much for that, Alice. A great presentation. And if you might have questions for Alice based on her presentation, please feel free to put them into the chat box. I'm not mentioned. It's almost as if history is repeating itself. We are seeing higher numbers of deaths from maternal or SRHR issues as opposed to the actual virus. I mean, even in Uganda, we are triple. We have numbers that go way higher than the actual confirmed COVID cases. And I think this also speaks into a projection that was made by Gutmacher in a recent report. They predicted that at least almost over 48 point something million women would go without would end up having unmet need for contraceptives if the COVID-19 response continues not to have a gender lens. They also predicted that there would be even up to 28,000 and up to over 3 million additional, 28,000 maternal deaths and up to over 3 million additional unsafe abortion in a year's time. And this is in low and middle income countries. So now I want to reel in Anne Lumbasi from SEHAD to just speak into that. What is it that we can do to ensure, from Alice's presentation, but then also from this research done by Gutmacher, how can we ensure that women across, from the grassroots level and even all across the country, do not just become a statistic, which is what we are slowly seeing?
Thank you, Winnie. I think Alice has done a great job in terms of touching even on the statistics. And I think what we need to remember is that even before the COVID-19 situation, the statistics on maternal health were already in a sorry state. So it's the situation around COVID only acts to compound the already bad situation. So, and of course, there are many implications in terms of women being unable to access health facilities, being unable to access commodities for family planning, and that would eventually turn into those estimates that Gutmacher was putting forward, that they will see more increased maternal deaths, we'll see more increased deaths from unsafe abortion. I think that first of all, the coalitions that we need contribute to some of these issues to see that these statistics are turned, turnaround of the statistics that we are seeing. And in the face of the challenges, we have seen partners come up to do one or two things, but I think they still need to do more. In the wake of when we were seeing women dying, not being able to access health facilities because of lack of transport, as a coalition together with other partners, we wrote a letter to the task force, informing them and bringing up those issues of the challenges that women were facing in accessing medical care and health facilities. And at least we saw a reaction to that. There was an exception for pregnant women to be able to access health facilities. Though, of course, that doesn't mean that everything is okay now. People are still, struggling, especially as Alice was noting that some areas are still hard to reach. And the transportation is key in accessing those health facilities at grassroots level, even for issues of family planning. If they have to access them at health facilities, they have to walk long distances, and that becomes another barrier again from already existing barriers to accessing those family, planning commodities. So we definitely need to do more in terms of supporting and putting interventions in our putting into plan the interventions that as civil society we're coming up with, or partners. We need to include those unique challenges, with those unique needs and specific needs that women and girls need to access, first of all, the services they need, access the commodities that they need. So we have to be flexible as a civil society. We have to be flexible as coalitions and networks working around sexual reproductive health rights. We have to also remember that these young girls, some of them, even in the homes they are living in, those places are hubs for sexual abuse. They've probably been in schools. Schools are sometimes a safer place for them than being at home. So they need that support. If it's in terms of information, even access to information, most of them don't have that. So maybe as a coalition, as partners, we can include in our interventions that being able to have that support. With one of the issues that we've done as SISMOA is to have those toll-free numbers for people to call, those who are experiencing domestic, violence of any nature, previous violence, sexual violence, and then the gender-based violence, and also those who need to access the services. We have partners who have their toll-free numbers, and we need to continue popularizing those numbers so that people who need help can have that help. And also legal services. We have a legal support network that we can continue to leverage and work around that to have the people who are facing issues that need, human rights abuses can come, forward and be helped with given that legal support that they need. We also have other, as partners, those relationships that we have created in the district at district level, the community health advocates who we have, the district health officers that we can leverage on those relationships to see that the services are able to reach the people who need them. And also, of course, continue working with government, but like most of these services or essential service providers, we've continually seen a mutation of who the health, essential services providers are. So we can continue to advocate that some of these services are put on priority, prioritized as essential services, because they have implication on people's lives, and livelihood, even after COVID. So we need to continue with our advocacy around, even to the task force, to make it to prioritize these SRHR services, for women and girls who need them. And also, of course, we have service providers under the coalition, and at least I know that some of their clinics are still open, even at grassroots level, and they continue to encourage people at least to walk in to be able to access those services. Also, the other thing that we have done is to work with government in terms of, reaching out to say where can civil society play a role in addressing some of those implications on SRHR issues, but also the human rights issues that maybe were not foreseen. We've also had webinars. I know that at grassroots level, maybe most people may not be able to access this, but we can have messages running on radio stations. We can have messages, strategic messages running on TV for people to access that information and in one way or the other, continue to encourage people to access these services. I know there's even the fear of going to health facilities for the fear that you will catch the virus from those health facilities. So even that alone, that information is helpful for people to be encouraged to go to health facilities. We can also, do newspapers, reach people through the newspaper articles. If they are unable to access TV or radio, they can be able maybe to access newspaper articles. We can put our information right there and encourage policymakers that even that information will reach policymakers in terms of holding them accountable. Because I think that as much as it's the fight to against COVID, but we should not also lose the gains that already have been made either by civil society or by government in terms of sexual reproductive health rights. So that should be there should be a striking of a balance in terms of addressing the pandemic, but also ensuring that those gains that we've made are still we don't lose them after the COVID-19. I think also the other thing that we can do as coalitions is to, continue with the coordination. I think that the advantage of working within a coalition is it gives us a large base of support in terms of different partners are reaching different constituencies, and we're able to reach a bigger base. So I think that with coordination, a better coordination, well-coordinated interventions, we can do more as the networks and the coalitions that we work under. And it also provides a safety, I think, for advocacy efforts. So for some of these issues, even when we're talking about unsafe abortion, some of those issues, they are with us and they are contributing to those statistics that we are seeing. If 76 women are dying, in a week, that should be a cause of alarm. But yet some of those deaths may be coming, out of, yes, some women are not able to access health facilities, but also their unsafe abortion because of, again, the unmet need and therefore the unwanted pregnancies that are happening. So I think those are some of the things that I would like to propose and to share, and also I think recognize the networks that have already done some work to see that the impact that either the lockdown or the COVID-19 has come with are minimized, or have strategies to overcome. So thank you. Back to you, Winnie.
Thank you so much, Anne, for that. And you do bring very viable points, stressing the fact that we do need to have collaborative work, especially on a multi-sectoral point of view. And then also, again, reiterating how important it is for us to know the numbers, to know the statistics, to know what's causing them, and to actually do something about it. Now, both from Anne's presentation and then Alice's presentation as well, it's very clear that data cannot be underrated. or even underplayed in discussions of COVID response when it comes to advancing women and girls' rights and for marginalized groups as well. But then we notice that there is still a huge lack of access to that data. Who is carrying out data? Where is it being consolidated? Questions like that come up, and they also pose a challenge as civil society or as various movements to then push forward and advocate for change. So I would like to bring in Professor Grace Chomuhendo to speak to us on how it is that CSOs and local movements as a whole can be able to maneuver the challenge of lack of access to data, and then also how is it that we can also utilize data in our advocacy towards advancing women and girls' rights. Professor?
Yeah, thank you very much for inviting me, and I want to thank the two presenters who have actually given us the baseline or the as is. As you have rightly said, data is so critical and very important in the fight and advocacy for women and girls' rights. But in this period of COVID-19, we are still facing a historical problem of data, and it starts right from the point of generalizing. We tend to take women as a homogeneous group, girls as a homogeneous group. And even when we are thinking about the different outcomes that we've been talking about, we don't know which women and which girls are more vulnerable than the others. And so that makes it very complex for the local movements to really do effective advocacy and improve the situation of women and girls. As I listened to the data, the question that ran into my mind immediately was, what was the situation before? And who are the women at that point who are maybe more affected than the current one now? I was asking, which women, are they the urban women, are they rural, are they the illiterate? Those are the questions that ran in my mind. And that is the biggest challenge that I think as local movements we must overcome, unpack the women, unpack the issues, unpack the problems. For instance, now, everywhere you check on web now or whatever, it is all about gender-based violence, which is rightly correct. But given the nature of COVID, which is challenging the social and gender norms, actually they are unsettling the gender relations. They are changing the power relations, they are changing expectations. What is it in COVID that is actually impacting on women's and men's rights? Is it just the lockdown? But if it is the lockdown, what has the lockdown produced in the home? Has it changed the power relations? We don't know. Has it really fused the space, the public and the domestic, and people really don't feel comfortable in performing in certain spaces where they must be? Like if men are used to go out and now they are confined in the home, how do they still remain as heads of household, and how do they yield the power? Could it be that is affecting the rights of girls and women? We don't know, but we know that the numbers have been, that they are increasing, but I would love to see the numbers before COVID to see how they're increasing and by what percentage and who exactly is affected. So we need to really unpack and interrogate the data. And secondly, we need to move beyond just the sex disaggregated data. As local movements, we must know that, okay, men and women, women and girls, it is the first point of reference. But we must move to the other details of age, of region, of economic status, of even education. Those all matter in advocacy and also in programs. So we need to move to that. The other question that you related to the sources of data, and I think that's the biggest question, because most of the data that we access are not of high quality. You know, we can't really make serious decisions with that data, and most of it is administrative, and we can't know the prevalence, we can't know the magnitude, but we do go ahead and use it. I remember one time we were advocating for the gender-based, talking about gender-based violence in Parliament, and many members of Parliament came up and said, "You people, you just go to villages and interview a few people, but what is the percentage? What is the prevalence?" And they had a point because they said they could not budget with small data. But I'm happy that because of those questions, we have the Gender Bureau of Statistics definitely addressing some of those questions. The other question is how accessible and in what form. For many of the civil society and the NGOs, accessing this data is not easy. And the form is also not defined. Sometimes if they give you a data set, many times the local movements do not even have the capacity to analyze that. So many times there are figures thrown to us, and at the end of the day, we can't know how we are moving, and if we are really making a significant move, because the data we are accessing is not adequate. I would also ask, maybe for those people who are here, the local NGOs and so on, how many access the database for Ministry of Health? Ministry of Health collects massive data on a daily basis, and it's all compiled at the headquarters. But how many of you have accessed it? How many of you have unpacked it and actually pulled out most of the data that you need? So I think as a way forward, one, I think we need to unpack the data that we get after defining the clear problem and the cause of the problem. Because we know that maternal death, they are saying maternal death has increased. And the other day we had a debate, and one of the health workers were saying, some of those officials were saying, because we think it has increased because very few women are coming to deliver in the health facility. But is that a good indicator? How do we pick the actual data, that the number of women who are dying? How do we pick the abortion data? How do we pick data, for instance, no one is talking about the child marriage. This could be a time bomb because people are at home and they are unable to feed their families. So there could be really an increase in child marriage, but we don't know. We also think that maybe because the schooling has been cut off, that there is a possibility that many of the girls may never go back to school. But we don't have the data that is telling us that, and even when schooling begins, we may not even have the capacity to generate data. So I think one of the proposals for the local movements and civil society is really to build capacity for data management and data application for advocacy, and seek the data based on the clear data that actually has indicators of most of the key SRH issues or the rights issues. We should know which rights are being violated most and who is affected most. Right now, we are all saying women, including, all of you who are on this webinar, but you may not be the target who are really suffering, but who and which maybe region is suffering more. We recently assessed the child marriage data, and we found that some regions using UDHF data, we found that some regions had a bigger problem than others, and yet we had just been talking about child marriage increase and so on. So we need to unpack the data, orient the civil society, and know that without that data, we are going actually to be saying the same question. As I listen to the discussions and even as I listen to myself, the question is, what new thing are we saying? What has COVID really, what has COVID-19, new thing, the new thing it has generated, that is, it makes us say, oh, wait a minute, I think this we may need to address it differently. Secondly, as bad as COVID-19 is, has it shaken some of these traditional gender norms, that it has actually fractured them, that which we may take advantage of and change these gender relations? That is the discussion we are not having. So we need also to see, is it providing us an opportunity for certain groups of people that we can actually break the cycle of gender inequality because of what has come up. So we may need also to think about that and see how we can actually build on that and enhance and address gender the women's rights and gender inequalities. And finally, we must actually build alliances with the people who are collecting data. I saw UNFPA had quite a lot of data, and I'm glad they're sharing it. But I think we must build alliances with all the other agencies that are collecting data. And Uganda Bureau of Statistics is one of them. And because of the massive campaigns, Uganda Bureau of Statistics is collecting a lot of gender-sensitive data. The only challenge they have, they don't analyze all of it. And those data sets are available to the public, are available to the civil society. So I would urge the local movement to actually liaise and work with the Uganda Bureau of Statistics to use that data for advocacy and programming. I think that's what I wanted to say about data, but I also want to note that the civil society actually are doing a lot of work. They're doing a lot of work and making a lot of changes, but many times we fall short of accessing the right data or even having the right data to measure the steps that we are making. And consequently, we are always saying the same story that we have said. And we have talked about, government should come in, we are sensitizing, we should be, take this way, the health facilities should change, but we have, I think, to take business, to do business unusual and look for something that are going to crack the mantle, that really improve the lives of women and girls. Thank you very much. Hello? Hello?
Yes, we can hear you, Professor Grace. We're hearing you very well.
Thank you so much, Professor, for that insight. And hello, yes, Professor.
Hello, have you been hearing what I was saying?
Yes.
Well, yeah, we were hearing what. Sorry, everybody. I think Winnie is experiencing some internet connection, so I could just briefly jump in for her, but I'm sure she will be coming back on. I hope you can hear me very well. This is Patrick. Professor Grace, we were hearing you very, very well, and you actually nailed it, if I'm to use my language, in terms of, emphasizing the need for local movements to understand and interpret data and available evidence and use it for their programming, and also going further to tell us some of the institutions that actually are doing a lot of gender sensitive research that we can run to and get information. I think as Winnie comes back, I'm now going to invite Eunice. who is also a big-time feminist and working with Akina Mama Africa. She has mentored and trained so many feminists, both in Uganda and across the East African region. So, we also know very well that Akina Mama is like hosting, I think Eunice will tell us more, but is hosting like one of the local feminist coalition or movement, something like that. So Eunice, I think you can come in straight and go for it. Thank you very much. Yeah.
Thank you so much, Patrick, and thank you so much, Winnie, and the entire family of the Uganda Youth and Adolescents Forum. It's an honor and privilege to be part of this conversation. I like what Dr. Grace said, that all the webinars and the forums that are being hosted are now focusing on gender. And in my mind, I was like, it's about time that we did focus on women's rights. So yes, once again, my name is Eunice. I'm the Executive Director of Akina Mama Africa. Due to time, I'll go straight to the points that I wanted to make. I wanted to highlight that pandemics, as everyone has said, make visible what has been invisible to many for a long time. So I'm glad that this pandemic is giving more visibility to what has been covered, not to everyone, but to a few. And therefore, I'm glad that this conversation is happening now. So like everyone has said, the pandemic is magnifying existing inequalities in different areas of sexual and reproductive health rights. But it also gives us an opportunity to learn from other previous pandemics, Ebola, HIV/AIDS. What is it that worked that we can magnify in this pandemic? And it was quite surprising that at the beginning, we did not learn from Ebola or from Zika or from HIV to say that the situation of women would be different. In Uganda, we know, for example, at the highest level of decision making, the president began off by trivializing sexual and gender-based violence, saying, oh no, you know, it's not essential, it's not a priority. And I'm glad now that we can see that trajectory is changing and moving towards more attention to it, so more sensitivity, but not yet at the level of a strong response that we would like to see. So the second point I would like to speak to is that pandemics as well really magnify the divide between the powerful and the powerless. And again, this is exemplified by, if you look for how many young people are even part of the task forces that have been formed right from the local level to the highest level. If we are to do a screen or spotlight the National Task Force on COVID-19, how many youth are represented on that task force, despite the fact that we are a youthful nation. So pandemics as well magnify that divide between the powerful and the powerless. And this again goes to speaking to the issue of privilege and the less privileged. In our parts of this side of the country, we're asking questions around, can we actually social distance? Is social distancing possible in Uganda? So that is a mechanism that can actually work elsewhere. So again, that divide between the privileged and those who are less privileged. But again, even to talk about contraceptives, how many families are able to add contraceptives as an essential product on their weekly shopping list? So I've had young women speak to the fact that when purchases are being made during this period, they are not able to say, oh, please add menstrual hygiene products to it. And we all know that for many young people, many young women and girls, they do not have the ability to make those decisions as well. So that's the second point I wanted to make. But then it's also an opportunity for us to rethink, to reorganize, restructure, and equal power relations, as Dr. Grace Bantevia has spoken to. I was heartwarmed to see the government reach out to sex workers to appeal to another sex worker. So previously, this was a cohort or a group or a constituency not recognized, but then when they recognize that it's a key population, then they were reached to. So it's an opportunity to rethink a number of structural inequalities that have been entrenched for a long time. So issues of safe abortion, menstrual health, maternal health, LGBTI rights, it's an opportunity, and I do hope that we'll be able to exploit it. I'll quickly move to what remain as challenges for local organizing. Issues to do with, there's a lot of undocumented or unrecognized efforts of young people organizing. So what gets documented and recognized are the huge groupings that are organizing. But we know that young people at the grassroots are actually responding to this pandemic in several ways, providing information, sensitizing, community support, etc. The other challenge for local organizing is that many young people have also experienced loss of income. And I mean, movements have to be fueled by resources. So that is also going to be a major challenge. A challenge that is not being spoken enough about is the issue of mental health that is being exemplified during this pandemic. Not even simply by social isolation, but the whole fear that has gripped us over potentially that this that could die. When you think about young people living with HIV and AIDS, thinking through and knowing that, okay, you are vulnerable because of pre-existing conditions also is an issue that can exacerbate mental health. And for me, the hugest challenge has been lack of a feminist lens in the approach to this pandemic. Yes, Alice, I listened to you speak to the fact that religious leaders are now speaking to issues of family unity, paying attention to sexual and reproductive health and rights. But we also noted that even when the message came out from the Archbishop, it was still emphasizing responsibility on the part of the woman, not necessarily responsibility and equality between men and women. And those are some of the messages we need to debunk. I know that control over our own bodies as women and girls is critical, but that responsibility needs to also be shared. So the Archbishop's message, yes, great, but again, it was as well emphasizing that, placing the responsibility on the woman. Going forward, of course, I will say that we need to take a feminist approach to our response. We need to think about issues that feminists have made noise about for a long time in terms of organizing. We need to think about radical issues like self-care. I know it may seem selfish at this point, but I have also seen a lot of frontline workers collapsing in this response. I know a young lady who was moving around at the beginning of the lockdown to really go through communities to speak to them, and then she was also taken ill. So we need to take care of ourselves before we take care of others at this time. Even thinking about what the times we are organizing meetings. Someone shared, what do they call them? Those emojis about the webinars, how many we are having, and what that means if you're balancing care work at the same time, children, etc. So all that, that's something that we need to think about when we think about how we organize going forward. We should not organize while we are also losing our frontline workers. The other is I see we need to foster greater unity within movements. First, the movement itself. So thinking about, for example, the sex workers movement, it needs as well to be strengthened as a movement and not as organizations, because right now they are responding to a huge crisis where sex workers are being they're being stigmatized, they're being arrested, they're being violated, etc. So we need a strong movement within the smaller movements. But then also we need to strengthen cross movements within that. So if it's an issue that is affecting sex workers, how are women rights organizations as well coming in to join in? Sometimes there's that divide between the SRHR movement and the women rights movement. So strengthening those bridges is what I see as an opportunity in this pandemic. And then I also feel that we need to amplify voices of those who may not be in the spaces that we are in. I don't believe that there's anyone who is voiceless. Everyone has a voice, but what we can do better is to amplify their voices. And so even in our own organizing, we need to make sure that we are creating spaces for different formations and organizations to also speak out. And I want to celebrate you, Uganda Youth and Adolescents Forum, for ensuring that even Hajara is part of this conversation. So that no one else is speaking for her. She's not voiceless, but we can also amplify her voice and lobby in spaces probably where she is not. So I'll end and say, going forward, the messaging that we are giving also needs to be clear. The messaging should not further entrench gender inequality and women's rights, and placing, I haven't had strong messages from the religious leaders on, for example, sharing the care burden at work, the care burden in homes during this period. The messages that have been given on children's rights violations, they still could be stronger. And so the messaging as well is something that is going to strengthen local organizing and movement building. Thank you.
Thank you so much, Eunice, for that. I would like to apologize for suddenly jumping off the call, but my team was very quick to take on some of the key things that you highlighted. And I think one of the strongest is ensuring that we have an all-round feminist approach in ensuring that the messages and also the work that we are doing a gender lens and ensures that the so on that note, I'd just like to reel in Hajara, backing on what Professor pointed out before, that women and girls are not a homogeneous group. We need to ensure that our data speaks about the realities of the different groups of women on ground. So Hajara, I would like to pull you into the conversation, just to ask, on top of the different, obviously, SRHR challenges that we know are happening out there, we've also realized that key groups, key populations, including sex workers, but then also the LGBTQ community, face unique challenges on top of these challenges of being stigmatized, ostracized, and even left behind. I just wanted you to speak to that, letting us know what these challenges are, and even more importantly, what we can do to ensure that we have every woman and every person not left behind in the fight towards COVID-19. Yes, Hajara.
Oh, thank you so much, Winnie. And thank you so much, Uganda Youth and Adolescents Forum, for giving me this platform to speak on behalf of key populations in Uganda, especially the sex workers and also the LGBT community. Yes, key populations have been left out in the response for COVID-19, and we've seen that we are challenged in so many ways. Like some of the, the challenges that we have increased arrests, both for sex workers and also the LGBTI community, because like we have our 17 LGBTI members who have been arrested and they are in prison. After that, they are just dodging them. Our people are still in, in prison, and we don't have. They can come out if they can come out, and this and. High have been arrested in many districts of the country. From media, like yesterday, because we arrested, including this. But arresting sex workers is not the issue. The issue is about food. Key populations have been left out in the COVID-19 government food program. Because we requested them that we should be part of the task force, because like communities of sex workers, they operate in so many hotspots. Yeah, it's hard for them to not to eat so that they can do so.
Hello, Hajara. Sorry, there seems to be an issue with your sound. I want to say that Ugandan thing and ask if maybe you could move a bit, because there seems to be network issues of sorts. Okay.
Hello.
Yes.
Can you hear
yes,
me
we
now?
can hear you now. Yes,
Okay,
much better. Thank you.
Thank you so much. I was saying that key populations have been left out in the response for COVID-19, because we know that key populations have the highest HIV prevalences in the country, especially the female sex workers, but they don't have food. We've been challenged in a way that as organizations themselves to see that, especially those who are on art and those who are taking PrEP. But every time we go to communities, to take medicine to their, hotspots.
Okay, I'm sorry, Sanyu. There still seems to be some issues. There still seems to be some issues with your sound, and yet we feel like this, just as other panelists, you're just as critical. So what I'll do is I will bring in our next panelist and then bring you back on board. Hopefully the network will be much better then. Okay, sorry about that, Hajara. And we look forward to hearing you much later during the discussion. I would like to now address my next question to Tikala, who is the chairperson for the SheDecides Global Movement. Tikala, if you would just give us a brief of what SheDecides, considering everything that has been spoken about, and I know you've been having a keen ear, but then also in Uganda, but then also on a global front, as pertains to SRHR and then also gender equality as a whole. What is the movement doing, and how is it that we can sort of learn from it locally? Yes, Tikala.
Okay, great. Thanks. So much has been said already on these issues. I think we all know that with everything that's going on with COVID, issues of sexual reproductive health, gender-based violence, and just issues around the needs and urgency of women and girls is right now, most of the COVID measures are not actually taking that into account. And as a movement, as She Decides, one key thing for us as we stand on galvanizing a political movement where we bring in different stakeholders, not just and women speaking, but they need to bring in different stakeholders, media, at the global level. The key investment areas that we have done has been investing in local movements, and I'm sure that those who have been involved in She Decides Uganda, you have seen the efforts that have been there to kind of galvanize different stakeholders to kind of come together and discuss and have dialogue on the pressing issues around women and girls. I think one thing that we also need to realize that we're dealing with a very unique situation right now around COVID. However, the needs for women and girls have not changed. The same issues that were there before COVID are the same issues that we're still facing now, but obviously at a very higher level and higher rate. And I think what we need to start thinking about is how do we begin to do things differently? How do we also learn to start, as it was mentioned earlier on, really coming together and working together? I think with past experience, I've got a legal background, I'm a lawyer by profession, but with past experience of advocacy work and civil society organizations coming together and holding leaders accountable, you find that we are very fragmented in the way we do. And you find that there'll be this network or this alliance pushing for this particular issue. There'll be this civil society pushing for this, and the efforts are so fragmented. And what we do with She Decides is to say, as a local movement, there is a need to bring everyone who is looking at issues around women and girls to come together and have one strong collective force. And the power of numbers to hold leaders accountable is very, very crucial. And the power of working together is also very, very crucial so that the demands are amplified. And that's what we stand for. She Decides stands on 3 important pillars, which has been standing up and speaking out. And these are the things that have been discussed so far in the panel, where we're saying data is crucial. Yes, we need to kind of document the data. We need data management on these particular issues, and being able to share this information and publish this information to the decision makers is very crucial. And 2, the second pillar that we stand on is about changing the rules, right? So if we are seeing that the current COVID measures are not looking into the needs around gender-based violence or access to sexual reproductive services and all other needs, then we need to make sure that we're able to bring in advocacy based on the data that's there to actually change the rules, to change the measures that are in place. And the third pillar that the movement has been standing on is about unlocking resources. We all know that for us to have a strong movement, for us to have a huge impact on these issues, we do need the resources and the support. And with everything that's going on with COVID, it is a difficult time right now to mobilize the resources around women and girls and sexual reproductive health. As you're aware that, a lot of people right now are worried about the economic recession that could happen, about many people that are losing jobs. Right now, people are worried about just food at home. So the priorities around us are shifting a bit. More people are interested to have conversations around, how do I get food or relief packages? How do I manage just being at home? Or not, as young people, a lot of people are thinking, am I going to go back to school? What's going to happen with school? I think the way we're thinking and the issues that challenges should have a holistic approach to say, if we are addressing issues around unemployment, how do we have a holistic approach that it also caters to the well-being around the issues of the health needs or sexual reproductive health that women and girls need, but also having to think about strategically on issues around household, right? A woman that is facing domestic violence is happening within the household. Girls not going to school and having issues around rape happening within household. How do we begin to think of, if we are having relief packages going to households, how do these relief packages that are targeting households also target the social issues that are happening within the household as well? I think my point being said is the way we have been doing interventions need to be addressed and need to be done differently, number one. And two, we really need to start thinking strongly on those who are working on sexual reproductive health issues. How do we also begin now to start recognizing one another, mapping who's who in the space, and coming together and combining our resources so we have one force and one collective engagement and advocacy on these issues. And lastly, putting in place measures that have a holistic approach to the issues that we have. I think we're at a place where we no longer can just isolate the issues because we are facing a lot of economic impacts as well. And how do we align sexual reproductive health issues with economic impacts that are happening within the country? So I think that's what we have to share. And those are some of the things that we are working on in terms of investing in local movements around galvanizing efforts around thinking solutions that are more sustainable in that way than just once-off advocacy.
Yeah. Thank you so much for that, Tikala, and thank you again for stressing the importance of the movement actually benchmarking on the great resources that we already have within, but then also partnering with other very key movements in advancing the rights that we fight for, which is for women and marginalized groups. I would like to pull Sanyu Hajara back into the discussion, please. I'm assuming the network must be much better, and she will be speaking into the unique challenges that key populations, including LGBTQ communities, sex workers, persons living with HIV, and so much more, and what is it that we can do to address these challenges. Hajara? Hajara, are you? Okay. Hajara? Hello, Hajara? Okay, there must be an issue with her internet because I have failed to unmute her here as well. Okay, great, here you are. Hajara, can you hear us?
Hello?
Me.
Hello? Hello?
Yes, are you speaking on behalf of, are you with Hajara? Okay, just for purposes of time, I will move on to our, well, second to last, if we can get Hajara back on the call. Kudzanai, who is joining us from Zimbabwe, and just speaking about the Women Deliver Young Leaders program and how it is that you as a young leader has been able to be impactful during this COVID-19 situation, especially considering the fact that most young people and most women and girls at the grassroots level have been left out in COVID-19 response. Kudzanai? Okay. Okay, Kudzanai seems to have audio issues as well, but I see that Hajara is back on. Hajara, if you could address the question so we could go on.
Yeah, sure. Can you hear me well now?
Okay.
Hello?
Yes,
Hello.
we can hear you now. We can hear you now. We can hear you fine now.
Yeah,
Thank you.
so yes, key population. Okay, thank you. Key populations have been left out in the COVID response, and we've seen that there are many challenges that we are facing at the moment. Among the challenges, we have high stigma and discrimination from, local leaders, religious leaders, like they are saying, because what we are doing is evil and all that, God is, very mad with us, and that's why COVID is there. This is, fueling stigma and discrimination in communities where we live and work from. There is increased arrests of key populations, especially the LGBTI community and also sex workers. We have 19 individuals who are in Luzila prisons. Those are LGBTI community members. They were arrested and they found them in a shelter because they were disowned by their families. So from the shelter, that's where 21 were arrested. We managed to rescue 3 of them and 19 are still in the prisons. We've tried many processes to see that they can be brought to court and see that justice can be served, but the processes are very slow and they are still there. They were meant to come to court next week, but unfortunately we've just received emails. It's not possible. They have issues, they are delaying their case and all that. We have many sex workers who have been arrested, and if some of you read New Vision yesterday, sex workers were arrested in Kabale district and they were, paraded in front of media houses. They were arrested with their clients. As organizations, we've done a lot, to warn about our people about COVID and request them to stay at home. But when it comes to sex workers, they've been left out in the food program for the government because of high stigma and discrimination. When you see local leaders, they have removed their names in the lists of people who are going to benefit from the food program, and this is the reason to why they have got the reason to why they are back along the streets and they are doing sex work, which is putting their lives in danger. We are still trying to tell them, to stay at home, but at the end of the day, they are telling us we are dying of hunger. What do you want us to do? If the government is not giving us food, if our local leaders are removing our names from the lists, then what does that mean? So most of them are back along the streets and they are being arrested from the streets where they are working with their clients and all that. It's challenging in a way that as we are telling them to stay at home, they are telling us they don't have food. And if we are telling the government and also talking to local leaders to see that our people can also benefit from the programs, they don't want to hear anything. They don't want to listen because of stigma, which is very challenging, especially to our members who are positive and for our members who are on PrEP, because as organizations, we're organizing ourselves and going to health facilities to see that we can get HIV medication and take it to our people in hotspots where they work from and also door to door. But it's challenging in a way that someone can tell you, yes, I have medicine, but how am I supposed to take this medication on an empty stomach? Which is very, very understandable. And we have organizations who have secured funds for food for our people. Lady Mama's Bureau is one of those organizations, but it's challenging in a way that when you see the presidential directives, we are not supposed to give food to anyone. But again, we think about, taking our taking food to them, our people are not going to benefit from it. So we are going ahead and breaking, rules to see that we can be able to take food to our people, which is challenging in a way that we are not safe as leaders. But again, we have to take food to them so that they can be able to take their medication and adhere to their medication. We've seen that there is lack of access to HIV services and also SRHR services to our people. As we are reaching out to health facilities to see that we can be able to take some of the medicine to our people, but we cannot reach to everyone. It's challenging in a way that it's affecting the HIV programming for key populations. Yet we have the highest HIV prevalences in the country. Then we've seen that there is also many violations. Violations are very many and they have increased. They are beating key populations because of COVID, because of what they think that it's because of us. That's why this virus is in the country and all that. So those are some of, the challenges that we have. But yeah, we are trying to see that we can support our them. We've tried to do bulk SMSs so that we can continue sending them messages on SRHR services and also their human rights, telling them to report, human rights violations, reporting cases and all that. Lady Mamen's Bureau also has an advert on Bukedde TV. I don't know if some of you have seen it. I was on Bukedde TV last week, and we have an advert which will be on Bukedde TV for 3 weeks, from beginning from next week, telling our people about the myth they have with COVID-19. Sex workers, they are thinking that this is a disease for white people, and for them they think that if it's for black people, we don't have even any case of death in Uganda and all that. So that advert was to tell them to stay at home, was to tell them to stop working, to stop doing sex work, because at the moment they cannot even trust their clients. We are trying to talk to local leaders and also demand the government to include key population leaders and also our peers at community level to be part of the task force so that our people can also, benefit from these services. And among the HIV services, we've managed to reach out to many with HIV self-test kits. We've reached to many with PrEP and ARVs, and we have a program with UNFPA. It's a condom distribution program. We sent the numbers of our peer leaders and also the distribution points, because we have key populations like sex workers. Some of them they have partners with other, LGBTI community members. So we are distributing condoms to them. But it's challenging in a way that issues of access to medication, it's still a challenge to our people, because as we are trying to reach out to many of them, we cannot do that as organizations. And for me, my call, I want to thank you for this platform, but I also want to thank Akina Mama wa Africa for the platform they have for all feminist-led organizations and young women and girls and all that. Through that, for me, I'm thinking we can do joint advocacy, because we need each other now more than ever. The violations are high, GBV among key populations and, other people who are not key populations, as we are still struggling with COVID and the effect we really need to tackle as organizations, as civil society. Issues of GBV, those are some of the things that we've been speaking out, in forums of feminists. We've been speaking out about GBV. This is something which is coming up, and this is something that we to put at the back of our minds. After, COVID, this is something that will be there for us again to continue working on it. I've seen that there were many interventions that we've been doing as a society, but COVID has brought, impact on what we've done already. And as we are, discussing about this, I know some of the interventions have been affected by COVID. Issues of HIV programming, issues of, SRHR service, and issues of human rights. Like I said, we have violations, we have arrests, we have high stigma and discrimination. Imagine to remove key populations from the lists and they are not, benefiting from food programs and all that. So for me, my call is for us to come together and have strong partnership, because I believe if we are together, we can be able to join efforts and work around these issues that have come with that has come around. We can be able to tackle many of them if we jointly work together. This is something that we've been doing, but again, when I see this, the participants on this webinar, there are many that I know, but there are very many participants us after these discussions, after this meeting, to see how best we can be able to support ourselves in terms of advocacy, in terms of, interventions, to see which other countries, what they are doing, to see how we can borrow that and bring it in the country and all that. So for me, my call is to strongly work together, because I know we've been affected by COVID and challenges are still many. Yeah, thank you.
Thank you so much, Hajara, for that, and thank you for the amazing work that you're doing for in Uganda, especially because they are most prone to sexual violence, but then also even domestic violence. Hashtag that's running around. We are truly stronger together. So one of the objectives of this webinar is we get to work together to involve women amidst COVID. Our voice is only stronger if it's, and even louder if it's collective. So finally, we will be getting into the question section of this webinar. We're extremely apologetic about the fact that we've gone a little over time. It's probably because we started a bit late, but then also the various network issues we've been having. But if you will just stay with us for a few more minutes, and then we will get to address some questions. But even more importantly, we will also be able to share a report with you after this webinar, so you can get to both visualize and listen to some of the key things that were discussed. Yes, on that note, I would like to invite Kudzanai from Zimbabwe to share with us some key lessons as a young leader, a Women Deliver young leader. Yes, Kudzanai.
Okay, thank you so much, Winnie. First, I would like to thank you for offering this opportunity. Am I clear? Okay, so I would like to thank everyone for offering me this opportunity. Actually, from this side, we have done quite a lot of interventions, considering that the COVID-19 came in as a surprise to everyone. So as a young leader, we are mainly working in the grassroots at local level, especially in the rural areas. That's where I'm based right now. So with the Women Deliver Young Leaders program, it has really helped me with the skills of advocacy. And also considering that the program is mainly meant for the young people who are working in the most marginalized communities, those who are advancing the interests and also the rights of young people, especially issues to do with gender and promoting girls and young women's rights. So with this program, it has really offered me the skills to advance this advocacy work. Considering my work, I'm working here with the traditional leaders and with the local governments, where we are ensuring that young people are participating in decision making. So my input to this conversation, considering that we are looking at the issues of movement building and also advancing the interests of women and girls during this COVID lockdown, I would like to say that considering that advocacy of women's and girls' rights is mainly based on culture, marginalized area. So we also need to look into issues of culture to say if we are in Uganda in a rural district, how best can you make sure that you are not at the same time blocking yourself before you enter society? So considering that rural areas, they are guided by the structures which are there, which are mainly led by traditional leaders. They need to be critical in this time of COVID-19. Because what we are seeing here in Zimbabwe is that every decision we are trying to implement, everything we are trying to advance in the rural areas at this moment, the decision finalized with the traditional leaders. Sometimes you see that even if there is a statutory instrument or a new law by the government governing bylaws, governing COVID-19, it's difficult to overcome or to pass by traditional leaders because they are the gatekeepers. So as you are in the process of trying to bring every stakeholder together, you must consider that fact that there's the need to work with traditional leaders. And also there's an issue where we are realizing that now people are staying at home, right? So it means there is likely to be more interaction of families. So we're experiencing more domestic violence at the moment, where we are seeing if the husband used to be abusive every time when he comes back from work or from the field, now it means they are spending more time together. That woman or the lady is now more prone to violence, domestic violence. So those are the areas we are also experiencing here. And then in terms of our solutions that we are giving at the moment, we've mainly focused on engaging the gatekeepers, the decision makers, influencing their decisions and also educating them. I'm sure that in most developing countries, you will realize that all the decisions that we have, or most decisions that we are having, they are mainly governed by patriarchal systems. So for us to pass through them, we need to use a radical approach at sometimes, whereby we push for the needs and the rights of those who are marginalized. So for us here, we have created some parallel structures which will groom and govern young people as they are growing up and educating them. For example, we have got the Junior Council program, where we are making sure that those young girls and young boys, they are working together in pushing for decision making for the local governments at local level. So it means with that process, they are now being supported by us, the experts, and so the organizations which have an interest in the current situation. It means with the COVID-19 situation, these institutions are they are already there at grassroots level, where they are now ensuring that they are also pushing for positive changes. They are advancing the interests of those who are marginalized. And also there's an issue of ensuring that the voices and also the work of us at the grassroots is strong. We are in shortage of certain needs. For example, face masks. In many countries, they are now a must that you must wear. It's now a must that you must wear face masks when you're going out. So it means such services, are they available for the women? Considering that if a village has got 100 people and there are 50 men and 50 women, and a development partner or a civil society brings in 50 face masks, who are going to get those face masks? You realize that it's mostly men who get them first. So how best can we make sure that we are there on the ground and we distribute the limited resources that we are having equally, or ensuring that women also benefit more from these resources? So for us, we are making sure that we are there when the things are being distributed. When there is a service that is being offered, we should be present, and also encouraging those who are at the forefront of making these decisions to make sure that when something is being distributed, it benefits women. And also we need to realize that at this moment, families are together more than they used to be in during most situations. Right now it's a lockdown here in Zimbabwe and in most countries. So it means at the end of the day, the main challenge we are having is that families are staying together, they're spending more time together now. So it means with the patriarchal system that we have, it means when children are hungry, they will cry to their mother. I'm sure even in Uganda, when a child is crying, she will say, Mama, not Papa.
Yes.
So it means when someone is hungry, they're crying to their mothers. So it means we need to make sure that we create more supporting systems for these vulnerable mothers. And also for the young girls, schools have been closed. It means they are now more vulnerable to sexual violence, to early pregnancies. So contraceptives, they need to be at hand in every situation, in every moment. Thank you so much.
Thank you so much for that, Kutsanaya, and just in time, and stressing, of course, the value of local community leaders in us ensuring that COVID-19 response considers the rights of women and marginalized groups. And I think I see a lot of questions. Unfortunately, because of time, we might not be able to address them, but I'll just give them due regard. There's very clear acknowledgement of the fact that contraceptives had to reach communities, and then also a reiteration of what Professor was talking about ensuring that even the people at the grassroots are considered in the data that we are collecting. I would just like to pose the first question though to Anne from SEHAD. And Monica is asking the advocacy that Sisemwa has been doing, has it impacted the national budgeting process? And if yes, have there been any funds secured towards addressing SRHR and gender equality challenges due to COVID? Anne?
So to answer thank you for the question. I think to answer that question, yes, there were issues in the letter that we wrote to the task force. Of course, some of those issues were raised. However, it's not that there was no pandemic is going. So yeah, we haven't yet got a response, but yes, we raised that issue.
Winnie, unmute your microphone.
We can't hear you.
Results. face in their homes, but then also a question on marital rape, considering that it's a controversial issue. Is it accounted for? Is it being addressed?
Okay, so thank you. Yes, definitely have a role to play. The children are within our homes. So we have a role to play in terms of sensitization, in terms of information, in terms of safeguarding our children within the home. I saw in the chat group someone mentioned the fact that a number of parents as well do not have this information. A number of parents have shied away from sex education, age appropriate, comprehensive, because they believe that that's a role someone else should play. And I believe this is the time for parents to take their responsibility and do. And parents could also be helped with guides and toolkits on how to play this role. We're not saying that it should be left only to the parents. In my community, I have seen and done sessions for parents on how to speak to your children about sex education. And a number of parents are saying, oh, it's quite hard, it's difficult, how do you broach the subject? But this is your child who you need to safeguard. So yes, and also there are some safeguarding mechanisms that parents can put in place. I'll move to the next. The fact that our laws do not recognize marital rape does not mean that it does not happen. But that said, our laws recognize forced sexual relations as rape. Any time that a sexual relation is forced, there's no consent, it's rape. So it does not matter whether it happens within the marriage or not. And that's the perspective we would need to take. And during this, go unreported, but we've seen videos going around insinuating the fact that there's a heavy demand on women to provide sex for emotional satisfaction of men. And so it borders on that. And so we need to sensitize more, we need to share information, and we need to be able to address it when women and girls come out and raise this issue. Thank you.
Thank you so much for that, Eunice. And you are right. Yeah, I think you speak into exactly what Professor was talking about, ensuring that the data we are collecting is representative of not just the women, but the different issues that they actually face in their homes, but in the communities as well. So unfortunately, we've run out of time. We will not be able to look at the other questions. But just to answer, someone was asking about a report. We will be sharing a video recording of this webinar with you in our report, and we'll also be sharing a written report. More importantly, we'll have action points that we hope that Uganda Youth and Adolescents Health Forum, as well as partners here, will be able to take forward from this webinar. Just in closing, I would like to invite our panelists to say a word or two, just to stress how important it is for us to centralize women and marginalized groups' rights in COVID-19 response. So in the same order that you came in, perhaps I will invite you to speak. Could I please call on Professor to give your closing remarks? Professor Grace? Okay. I don't see her on the call anymore. Anne Lumbasi?
Okay. Yeah. So I think for me, my parting shot would be to just say that I think as coalitions, as partners, we are better off working together and having that coordination. Everything has been emphasized on the call, working together and the fact that, you know, we shouldn't sit back, despite some of the challenges that we have to think in terms of how we work in the new environment, because we represent vulnerable groups of people, and our work means a lot to those groups of people. So I think to just say, let's continue with the work and yeah, go forward, even despite the challenges that we see.
Thank you, Anne, for that. Eunice?
Yes, I just want to address one issue, applying a feminist lens to our response. I have just seen on the chat group, someone mentioned the fact that prostitutes should be taken off the street, that they should be given economic empowerment and something, rehabilitation. And I would like to invite, I would like to invite the person to read more, gain some knowledge, and also to recognize that already by calling sex workers prostitutes, she's further stigmatizing them and discriminating them. I tried to type 3 times and I said, no, let this one pass. So yes, it's very easy to other people without understanding their placing in life. So that's my take. Let's try and apply a feminist lens and a feminist approach in the work that we do. And that's why I called for bridging that divide between SRHR advocates and other movements. Thank you.
Thank you so much for that, Eunice, and for pointing out the importance of language when we're advocating for women's rights. I would like to now call in Alice.
Thank you very much, ladies and gentlemen. My parting shot would be that gender equality, access to sexual reproductive health and rights, as well as prevention and response to GBV, does not come easy. It is something that we fight for. It is something we talk about. It is something we lobby for. It is something we don't put to a shelf and keep quiet about. And therefore, my call to you would be that tighten your belts, fold up your sleeves, and continue the push until you get there, until you see gender equality for human dignity, especially for women and girls, until women and girls can gain their right and be placed at the center stage in terms of their needs, especially in as far as sexual reproductive health rights are concerned, so that they are treated with the dignity that they deserve even during pandemics like COVID. We should not rest. Therefore, I thank you very much, organizers, and I continue to implore you to please fight on until you get there. Thank you.
Thank you so much for that, Alice. And now, lastly, Kudzanai.
Okay, thank you so much. My final words are that it is possible to advance the rights of women and girls.
Sorry, we seem to have lost him, but so There seems to be technical issues with Kutsanai, but all in all, we'd just like to thank you all for being a part of this great discussion on harnessing the power of local movements in advancing the rights of women and marginalized groups, SRHR and women's rights amidst COVID-19. Key things that have been emphasized: the importance of data, who is collecting it, where is it being collected, where is it being consolidated, and how can we use it. Also important is how is it disaggregated. Then also the importance of collaboration of different movements, but then also different organizations in advancing these rights, and overall ensuring that we adopt a feminist approach towards on all fronts, including our messaging, including the work that we are doing, but that also takes note of the key frontline workers. So thank you once again for joining this call and for being patient with us. And we look forward to sharing the report with you. Have a nice evening. Oh, and thank you again to our wonderful panelists and also to the team that has been curating the chats, but then also stage managing, so to speak. Thank you, everyone. Have a wonderful evening, and please continue to stay safe. Bye.